top medical body of India, ICMR, undertook a study to evaluate whether the BCG vaccine, primarily used against tuberculosis, is effective in preventing COVID-19 in elderly population or not. This study is yet to be peer-reviewed, but has been published in some journals. But the findings say that there might be some protection. We have seen international experts on our show earlier speculating about the link of the BCG vaccine and COVID protection. Dr. Robert Gallo, who's HIV co-discoverer, came on our show earlier and had stressed on repurposing vaccines like BCG and oral polio vaccine for COVID-19. Now, the study says that BCG vaccine is associated with enhanced innate and adaptive memory and also total antibody levels. Study was conducted on individuals of 60 to 80 years and they were given the vaccination and then the study was done 1 month after this vaccination. For more on this, I am joined by Dr. Sunila Garg, who's Director and Professor of Community Medicine in Maulana Azad Medical College and Associated Hospitals, also Fellow of WHO and Advisor in ICMR. Thank you very much, Dr. Garg. Also joining us is Dr. Vikas Oswal. He's a pulmonologist and also National TB Elimination Program Trainer in Maharashtra Chest Council of India. Thank you very much, both of you, for joining in. Dr. Oswal, I'll begin with you. You've been working with tuberculosis for a very long time. You will be able to tell us whether this BCG and this link between COVID protection, what is the science behind it, if possibly there is a link?
Yeah, so sir, first let us understand what is this BCG vaccination. It was basically a Bacillus calmette-guerin, which was a live attenuated vaccine, which was a strain of Mycobacterium bovis. To prevent against this vaccine was been innovated in 1921. But this vaccine also had some other protective heterologous infections against the immune system was being developed. That is what was being studied for this corona vaccine also. So there was basically an observation which was been made that this vaccine is working in two different types of immune mechanisms. First is like the BCG was known to induce the CD4 counts and CD8 memory T cells in antigen independent manner, but in cytokine dependent manner, which had got this heterologous immune system development boosters. And secondly, it was been seen that the innate immunity memory in innate cells were been really very much helpful. So this BCG vaccine was been given to the elderlies of 60 to 80 years, and then the innate immune system was really boosted. This was been observed, and which was been studied 1 month later, the giving of BCG vaccine in this elderly people. And this somewhere really, helped us out to a great extent that yes, somewhere this BCG vaccine is going to definitely help even in prevention of this COVID, that is SARS-CoV strain.
Right. Dr. Garg, this link was being, pointed out by multiple experts across the world. Now, how do you see this? Would this benefit the cure, or not cure, sorry, the prevention of COVID-19 in future in any manner?
Actually, you see, basically we are looking at three kinds of things. One is looking at the severity of infection. Second is reducing the risk of pneumonia and reducing the virus replication. So ultimately, these are the ones which are responsible for high mortality in elderlies, and particularly elderlies with comorbidities. If we are able to prove that, as has been mentioned earlier, that this will happen through boosting of our innate and adaptive immunity both. So once these immune cells are boosted, so they will definitely act in this direction. But then also it has been observed that in the countries where universal immunization program is there, which is already incorporating BCG vaccine like India, we are having less severe forms of coronavirus infections. So that is where, so this is an initial study which has been conducted on 86 individuals in which 54 were given the, this BCG vaccine. The largest study is already on the way, which is being carried out on the 6 sites of the country. So we will, if this comes out, then this is one of the very useful repurposed vaccine till we have a vaccine against COVID-19.
Right. Dr. Oswal, very briefly, I would like to ask how important is it to look at other vaccines, like there were some experts who were mentioning the oral polio vaccine as well. So how important or cost effective it is to look at already existing vaccines as a possible prevention step?
After the oral polio vaccine, there are no studies yet now. Still now, we have given a confirmed or some great findings. But for BCG, definitely they have given us a very good observation. That is because there is a less mortality, children mortality in cases of developing countries wherever they have given BCG from the childhood. And the developed countries where they haven't given BCG, the children mortality for COVID is on the higher side compared to us. So somewhere this BCG have been proven to a very great, useful vaccine for all of us. Rather than waiting for a new vaccine, somewhere the BCG, which is existing vaccine right now, is definitely going to give us a very good cost-effective. It is going to be a very good cost-effective vaccine, and which will be useful for all of us. As such, we all are using this vaccine. So it is just that we require to show its implementation and beneficiaries from children to adults also.
Right.
So it won't be too costly.
Right. Thank you very much, Dr. Garg, for joining in, and thank you, Dr. Oswal, as well. But I will request you to join us later for answering the questions, Dr. Oswal. Thank you both. And now let's talk about Germany. Germany has imposed severe restrictions on movement in Germany. Bars are shut, restaurants have closed down. Owners of small businesses and restaurants and cafes and bars have been protesting in Berlin. But Chancellor Angela Merkel has defended these restrictions, saying the rapid spread of the coronavirus has pushed the healthcare services to their limit. And if you look at the number of deaths that we are showing you right now, it shows how it is increasing. And also, the daily death count is increasing. We'll show you the number of daily cases that are coming in, and it shows in the graph that how the second wave is even bigger. And now to talk about this, we have Deutsche Welle correspondent Thomas Sparrow joining in from Berlin. Thank you, Thomas, for speaking with us. Now, how bad is the situation in Germany?
The situation is certainly very serious here in Germany. Yes, Germany has fared comparatively well if you look, for example, at the US or at other European countries, but coronavirus cases here are increasing dramatically on a daily basis. Some of Germany's major cities are now considered hotspots, including the capital, Berlin, and the country also exceeded the grim milestone of 10,000 coronavirus deaths.
Now, given this increase in public life, are people just continuing with their normal life, or are the restrictions really impacting heavily?
German authorities, and in particular Chancellor Merkel, have repeatedly asked people to reduce contacts to an absolute minimum and stay at home whenever possible. She has called for solidarity in what she has described as a very serious phase of the pandemic. And Merkel has also said that Germany is facing difficult months. It's important to remember that the colder months are approaching, where people will be mostly indoors, and also Christmas, where people tend to meet. But given the numbers, even some of Germany's world-famous Christmas markets have now been cancelled.
Right. Also, you were on the streets of Berlin asking people what they think about these increasing numbers. How concerned are they?
That's correct. In some of Berlin's busiest streets, people now have to wear a face mask both indoors and outdoors. Many of the locals I actually spoke to understand the need to introduce further measures, but I also sense some skepticism as to whether Germany altogether is going in the right direction. There is also a small but a loud minority which is against restrictions and which has been protesting on the streets. It is all in all a very difficult time both for Germans and for Europeans in general.
Right. Thank you, Thomas, for joining in and giving us this update on Germany. We are going to take a quick break. On the other side, Dr. Vikas Oswal joins us to answer your questions. Welcome back, and now it's time to answer your questions, and Dr. Vikas Oswal is with us. Dr. Oswal, let's take the first question that has been sent to us.
My name is Devanshu Shukla and I am from Delhi, and my question is, what happens when a pregnant woman gets coronavirus?
So, Dr. Oswal, what happens when pregnant woman gets COVID? That's quite worrying.
Yeah. Pregnancy, definitely we are worried because this is the question of two lives together, that is mother as well as child. But there is no extra precautions what we are taking. It is just that the D-dimer levels, the coagulation factors, which we just keep a check on to keep them under control. And we treat the patient same as a regular normal patient. Let it be a non-pregnant female or a pregnant female. But yes, we be a bit overcautious and keep a patient under good close observation.
Right.
Rest all treatment medications would be same as per the symptoms.
Right. Let's take the second question sent by Sakshi.
Hello, my name is Sakshi Nanwani and my question is, people who got recovered from COVID-19 now have a thinking that they are immune to it. So are they really immune?
Doctor.
No, not really. The antibodies which are developed in the patients right now, what we are seeing is they are present in the body for around 30 days or maybe 60 days. And definitely we are again at the same risk as a common man who have never been infected ever. So the myth that once you have COVID corona ever and you've been treated with it and you're not going to get reinfected is a wrong thing. So suppose if you have been treated properly, still there are equal chances of you getting reinfected, definitely. So the thing is, you have to follow social distancing, you have to follow wearing of mask and sanitization, hand sanitization. It is required.
Right.
There are cases, many cases. There are many cases who were positive maybe some 6 months back, and again after 3 months or 4 months, they have got reinfected. They have been positive again. So we had to treat them twice.
Right.
So there are complete chances of you getting reinfected.
Right, absolutely. We have seen some official cases of reinfection in other countries as well, in our country also. Thank you very much, Doctor, for answering these questions, clearing these doubts. Now, let's talk about Delhi. Now, at a high-level COVID review meeting with Union Health Ministry, Delhi blamed air pollution besides a host of other reasons for a 46% rise in coronavirus cases over the past month. Meanwhile, doctors say that they are seeing more serious patients in ICU this year due to double whammy of pollution and COVID.
After reporting its highest ever cases, Delhi's third wave is now prominent. However, the government says it can't be called that yet, and the numbers are rising because of tighter contact tracing and testing.
त्योहारों का सीजन है, थोड़ा सर्दी भी है. एक हमने स्ट्रेटेजी चेंज करी कि भाई जो भी पॉजिटिव आता है उसकी पूरी फैमिली को और उसके क्लोज कॉन्टैक्ट्स को सबको टेस्ट कर रहे हैं. तो अभी थोड़ा जल्दी होगा कि तीसरा वेव का ना, पर हो भी सकता है.
Delhi has also increased the number of RT-PCR tests, the gold standard, from 18% in mid-September to 29% now. However, doctors at this major government hospital say they are now seeing almost twice the number of ICU patients because of the air pollution.
टेम्परेचर कम होता है तो जो डिजीज सीवियरिटी है, सीरियस नेचर के पेशेंट्स अब हमारे इमरजेंसी में आ रहे हैं. आईसीयू की रिक्वायरमेंट भी हमारे यहाँ पे बढ़ी है. प्रदूषण की वजह से ऑक्सीजन कम होता है एयर में, और कोविड की वजह से भी. तो दोनों फैक्टर यदि मिल जाते हैं तो पेशेंट्स को जो सांस लेने में जो तकलीफ है वो बढ़ जाती है.
A report by the National Center for Disease Control this month had said that Delhi may see up to 15,000 daily COVID cases in winter, out of which nearly 3,000 would need to be admitted in a hospital every day. In New Delhi with camera person Sushil Rathi, this is Sukirti Dwivedi for NDTV.
Now, COVID has adversely affected children's mental health. Young children are suffering from overcrowding or fear, and older children have complaints of stress, anxiety, nervousness. Many are now turning to doctors and counsellors, and in some cases, there have been hospitalizations as well.
Naomi Kothari is a speech and language therapist. Her son is a 1-year-old and has not been out of the house for 5 months. He was uncomfortable with unknown faces and crowds. This is called agoraphobia, where an individual fears and avoids unfamiliar places or situations.
हम घर के अंदर 4-5 महीने के लिए थे. बाबा कहाँ पे गया नहीं था, नीचे भी गार्डन सब पब्लिक स्पेसेस बंद थे. और फिर 5 महीने के बाद जब भी हमने वैक्सीनेशन के लिए डॉक्टर वोरा के पास गए थे, तभी हमारा बाबा इतना रोया कि आँख बड़ी बड़ी हो गए.
मुझे लगा कि 12 महीने का बच्चा इतना कैसे डर रहा है. तो फिर मैंने बोला पेरेंट्स को कि वापस 15 दिन बाद आओ. हम लोग इसको आर्गोफोबिया बोलते हैं, एक प्रकार का फोबिया होता है, ये बच्चे को वो हुआ है। तो हम लोग ने ये फटाफट पिकअप किया और मदर भी एक थेरेपिस्ट है तो उसको समझा के पूरा ट्रीटमेंट किया।
The Bengaluru-based National Institute of Mental Health and Neurosciences, NIMHANS, reported that about 40 children are being brought in for treatment every day and around 35 children are undergoing counseling telephonically.
पेरेंट्स को ये समझना है कि इस समय में बच्चों को घर में थोड़ा उसको रूटीन थोड़ा प्लान करना है, टाइम पे कुछ एक्टिविटीज़ उनके साथ करवाना है और बच्चों के साथ जितना भी समय उनको मिलता है उनके साथ समय बिताना है।
During the COVID-19 pandemic, children are feeling locked in inside their homes.
हम सबकी ज़िंदगी कैदियों जैसी हो गई है, घर से बाहर जाने नहीं मिलता है और हम अपनी फ्रेंड्स लोग से नहीं मिल पा रहे हैं क्योंकि ऑनलाइन स्टडीज़ हो रही है। हमें थोड़ा सा बोर फीलिंग हो रहा है कि हम लोग बाहर जाएंगे तो कैसा लगेगा कितने दिनों बाद, और घर में कितनी बोरिंग सी फील हो रही है।
Doctors point out that cases of mental stress in children have now doubled compared to the time before the COVID-19 pandemic.
पहले हमारे पास ADHD, scholastic backwardness और sometimes behavioral issues के वजह से बच्चे आते थे, पर अभी ज़्यादा करके उदासी, घबराहट, तनाव, चिंता, शारीरिक सिम्टम्स के वजह से स्ट्रेस आना, ये कंप्लेंट्स की संख्या बढ़ गई है।
Experts say these cases are being reported from both cities and small towns, and amongst children of frontline workers, there are more cases. With Pooja Bhardwaj in Mumbai, Saurabh Gupta, NDTV.
Well, that's all we have for you in this show today. We're going to take a short break. News updates follow on the other side.